welcome everyone to Travelers Week. I'm really excited about today. I have Jessie Lee with me, who is one of our travel nurses. And so today it's kind of a unique thing that we're trying. We're going to just do an art hour with Jessie. And so if you have some of your supplies, go ahead and grab them so you can kind of follow along or just, do your own little thing with us. And then also she's going to be answering questions. So if you have any questions, go ahead and type them in as we go. We're going to be giving away a couple Worry Less, Travel More shirts with this. So if you do have any questions, you'll be entered into that. So be sure to ask them as we go. So I'll pass it over to Jessie to get started and introduce herself.
Hi, everyone. I'm Jessie Johnson, or otherwise known as Messy Jessie Lee, on Instagram. I'm a travel nurse. I've been travel nursing for the past few years. I've been a nurse for like 6 years now. I've been traveling for 3 years because I love traveling so much. I can't quit. I'm like addicted now. It's a great lifestyle to have. I get to meet lots of new people and go to new places, try new foods. And so, that's why I'm here interested in answering all these traveling questions for you guys, because I hope to either inform or inspire or just let somebody know that travel nursing exists and that it's an option for you to consider. So that's why I'm here.
Awesome. Yeah, thanks for that. And so I guess if there are any just general questions, I know, you're really active on Instagram and a lot of travel nurses ask you questions. So are there any ones that you get a lot?
A lot of the questions that I get are kind of like how to get started, or if you get lonely, or is it worth it to do it alone? Do you have to have a partner to come with you or a friend to travel with you? And my answer is usually if you're renting an apartment, as soon as your lease is up, start traveling. That's usually when most people start traveling, including when I started traveling. So once you can kind of get a more financially feasible living situation, I guess, at home is the time for you to start traveling. It's just, I guess, whatever excuse you can find to get yourself out there. Like us people that are kind of you don't even have to be young. People do this at any age. People start traveling, and a lot of people say that they hesitate because they have kids, or they have a relationship they have to be at home for, specifically if they're caring for an elderly family member or something like that. But if it's feasible for you to travel, why not? There's no time like the present. So, if you want to see other places, if you're scoping out other areas of the country to live, maybe your hometown, has not changed much and you want to get something that's different. I don't know, just experience the world, meet other kinds of people, try other kinds of food. I think living in a spot for 3 months is the best way to get to know a place. So
great. Yeah, and I don't know if you want to just start on the art part too, and then as we get questions in, we can ask those too.
Sure. So I'm gonna go for a very, very basic flowers here, because artwork to me is kind of like therapy time. And so I kind of call it my own art therapy, and I don't like to do anything too extreme. I want it to be calming and kind of mindless and kind of take my mind off of whatever's stressing me about work or not about work or whatever. So we're going to go with some kind of circular motions at first. So we'll try some little triangles for the center of our flower. Let me see if you can see it. Yeah, you can see it. Kind of. And then you kind of make these little elephant ears around. And it'll wind up looking like a big, I want to say a plumera. I don't know if that's correct. But the great thing about drawing flowers or any kind of plants is that it's pretty safe to bet that something like that exists in nature. So it exists somewhere. I was actually researching some stuff on like the mindset of like why we doodle. And it's because it's calming for us to like have our mind open to sense like essentially like a mindless activity where we can think about whatever we want. And so it's just something that you can do to let your mind think about what's actually on it, I guess.
Oh, cool.
So I'm like, see, there's some science behind why coloring is so therapeutic. So, yeah. And then I like to kind of go back and give it some swoops so that it looks like the petals like folding over. I know I'm far from a professional artist, you guys, but it's really fun.
Yeah, I love it. I've seen your stuff on Instagram and it looks awesome. Definitely more advanced than a doodle I would do.
Thanks. I'm gonna do a couple more in this color, but I do have all these colors here for options, and you can, whoever's doing this along with me, you can do it whatever colors that you want. If you like blue and green flowers, you do blue and green flowers. I just tend to go with the purpley pinky flowers. I'll do one right next to it too.
And it looks like we do have a question too.
Okay.
So what site do you use to search for housing?
I use both. What is it? Furnish Finder I use, which I know you guys did like a live event with them yesterday. That was pretty cool. I use Furnish Finder a lot, and then I also use Airbnb, but they're only really financially like makes sense if you're booking for over a month at a time because there's a monthly discount. Otherwise, Airbnb has significantly increased their prices for short-term rentals, so it's it's not cheaper than just getting a hotel at this point if you don't book for at least 30 days on Airbnb. And then otherwise you can use Facebook Marketplace, has a lot of rental listings now. I don't know if it's always been that way or if I just realized recently, but I've used Facebook Marketplace like twice for housing and had a good experience both times. I guess it's like the Craigslist of Facebook, but I don't know. I guess just all the bad stories I've heard about Craigslist. I have never even really looked on Craigslist, but I have heard some people have had luck using it. I just haven't used it yet. So Airbnb and Furnish Finder are like my two most often used sources for housing because they're all furnished and short-term leases. So they're all inclusive prices for everything that you need to. So you don't have to get there to set up like electricity and cable or Wi-Fi or anything like that. Everything's already set up for you. I'm gonna switch colors here. Go with this one. I'm gonna kind of disperse them throughout the picture so that we can then afterwards make some leaves like through the flowers.
And then along those lines with the housing question, I know that we talked about it when we did the blog feature on your experience. Can you tell us a little bit about how housing kind of changed for you when COVID-19 first started and kind of what you did in the interim while you were looking for other housing?
Yeah, so some of us actually kind of lost our housing. when COVID hit, especially the nurses who rented in units in houses that like other people resided. Like a lot of people will rent their spare bedroom or their mother-in-law suite or something like that on these sites. And a lot of people lost their housing when that happened because they didn't want to risk having a nurse or any healthcare professional that would be frequently exposed to COVID, or in their mind at least exposed to COVID without protection. They just felt like it would be higher risk having us in their houses, which I understand a lot. I totally understand that fear. Like one of my aunts rents houses, and she asked me if it was a good idea to rent to someone who was inquiring about her rental in her own home. And I told her at that time I honestly didn't really recommend it because she kind of met all the criteria for risk factors. She's like in her 60s, has history of coronary artery disease, other things that just make her a high risk patient per the statistics we have. And I just didn't feel like it was a safe recommendation. So unfortunately, people who were renting in like cohabited spaces lost their housing. And I don't know the exact reason that I lost my housing like a month into it, but I mean, it could easily be suspected that might have been a reasoning for them to kind of say that they were no longer renting that property after our lease had ended or was ending. But what was nice is that a couple hotel brands, they were giving away like a week free at a time hotel rooms to us travelers. All you had to do was show your nursing license, and they would give you a week at a time for free up to a month. So I did get a couple weeks of free housing from them. I think it was Hilton and Doubletree, if I remember correctly, were the two hotel brands giving the housing. So that was really, really nice. I'm not gonna lie, it was kind of nice to like, feel more appreciated by the community during this time where like, I guess the work of nurses is being brought to light to a lot of the population. So it was nice to have like some benefits to having our jobs. So I did that until I had found another place to live. But as soon as I found another place to live, since I'm in the San Francisco Bay Area, I locked it down. So instead of spending a full month, I locked down the place that came up. Because you never know when another place might come up that's as good of a fit for you.
Definitely.
So. Yeah. And I travel with my cat too, so finding pet-friendly housing that's in your price range and all that sometimes can be a little tricky. So I jumped on the opportunity when one came up. I might do one more different colored flower. This pink one. I'll go up here. And if anyone is following along with these colorings and making your own, you don't have to share it if you don't want to. But after this video is over, if you want to, I'd love to see it because I love seeing people's drawings after we're done with the previous art hours I've done just on my personal Instagram. And it's always so fun, and people tell me they had a relaxing time drawing. And I was just with one of my friends last night that had joined on one of my previous art hours, and she said that she tried to draw on her own like after we had done it, and she did not find it as relaxing. So she likes the guided drawings. And I'm honestly the same way with paint. I like to go to like painting with a twist or those other really common guided painting classes.
Yeah.
But I'll never really like paint at home on my own, but having a class is so fun. So.
Yeah, how do you find different activities to do while you're on assignment?
So, I like to book group activities while I'm on assignments because that's another way for you to meet people. And I mean, there are some solo activities that I love to do. Specifically, hiking is like a nice solo activity to do. But one way to find fun stuff to do and make you feel like you're socializing, even if you choose not to, are group activities that you can book through like Airbnb experiences, or you can book them through Facebook events. Often has like little festivals or like wine walks and stuff of that kind of nature that you can go to. Even like city tours, like on city buses, you know, how like, I mean, in New York and San Francisco, big cities have like those big bus tours where you can sit on top of the bus and it's like open. And so you're like riding on the roof of the bus. And that's a way to meet other people because people that are doing those kind of things are also like either new to the area or visiting. And it's just like an opportunity to be more social because it's a more social activity. Like everyone's having a good time. There's usually like, I don't know, some kind of like sometimes alcoholic beverages. One time I went on a whale watching tour by myself because, you know, everyone there is just kind of having fun and doing it too. And there was like lunch and drinks involved. And it was really nice. It's a really nice thing to do. It's like a little like cruise, you know, but it was just for the day to go out and have dinner and have wine and watch a bunch of whales.
That's really
out
cool.
in the ocean. It was very fun. That was in Boston. It's one of my favorite places, is Boston. But now I think it's a hard tie between the Bay Area and Boston, which one is my favorite. But the Boston winter is the only reason that I can't stay there full time. I love it so much there every other season. But there's a lot of snow there in the winter. Let me see. But yes, by far my favorite activity to do is hiking in different areas because I feel like after a while of traveling, everything indoors kind of feels like a city is a city is a city. Like, you know, there's only so many different kinds of bars and restaurants you could go to, but like getting out and like hiking or just walking, going to the different beaches. Some beaches have sand dunes, some are flat, some have huge rocks and like cliff sides. Like, you know, it's just they're always so different. The mountains with the different trees. I feel like seeing the actual like nature of an area makes you feel like you've really engulfed a place way more than just going inside to like restaurants and stuff. But food is a big part of traveling as well. I love going to all the nice restaurants, but the icing on the cake is the outdoor stuff for me. Okay.
Would you say that San Francisco's been your favorite area?
I think it really is, as of right now, my favorite area because, I mean, all year round, I've been out here since last November, and all year round, the weather is pretty mild in extremes of the seasons. Like there's no snow, but it does get really, really cold, but there's no snow. The summer, you can drive to different parts of the city or outside the city, and like the temperatures, they have microclimates out here. And you can drive 15 minutes and the temperature can be like 20 degrees different from where you were. Like it's crazy. And you have the best of both worlds, like with the mountains and the beaches. There's a lot of just like young professionals out here. So if you're a single person looking to meet other people of similar interests and stuff, this is a great place to meet people. I don't know. There's so much support for like creative minds out here too. I feel like a lot of people out here work in like digital design or some kind of, not filmmaking, but like kind of, I guess, like some kind of online creative thing people do out here, whether it's like photography or content creation for a business or something like that. And I kind of like that because obviously I'm interested in similar things, but I just like the whole feeling of the area. And it's very diverse too. There's a huge Asian population out here. They have a lot of amazing food out here of Asian culture and also of Hispanic culture. There's a lot of Hispanic people. A lot of international people here, a lot of people from India and Asia and Africa. There's just a huge amount of diversity, and I personally love meeting all these different kinds of people. Like, you might not have known people of these like types of mannerisms or culture for one reason or another even existed unless you traveled to that place to see them. And I think back to before when I started traveling, and I think like wow, I had no idea that I was going to experience all this. Like, no idea at all. Like, I thought traveling was fun just to see new places, but like I didn't realize that in different parts of the country there really was like whole other cultures that I didn't even know.
And yeah, so you're from Florida, and so how long were you a nurse before you became a traveler?
I was a nurse for like 2.5 years before I started traveling, or honestly, it was just a little over 2 years, probably not even 2.5 years. And honestly, that was only mostly because when I started at that particular hospital as my first nursing job, you went through a little nursing residency and you had to sign a contract for 2 years that you wouldn't leave. So you had to work for them for 2 years since they were putting you through a 3-month training program, basically a residency when you first started. And so you had to sign for 2 years. And I was really just waiting for those 2 years to be over before I started traveling. And I know a lot of travel assignments will list that it's preferred that you have 2 years of experience in nursing anyways before you start. But I've definitely met people that only traveled for a year before they started traveling. Or sorry, they only worked at a staff nurse job for 1 year before they started traveling, which, you know, it's a lot about, I guess, the experience that you had on your unit, what kind of unit you worked, and like how confident you are in your abilities. Because before you start traveling, you want to be confident that you can take the hardest or most difficult or sickest patient on that unit that you're going to in whatever level of care that you do, because you're honestly a resource a lot of the time. A lot of these places that need you to come as a traveler, the majority of their staff are very new, and sometimes you wind up even having to train new staff. I've been to some hospitals where they hired travelers to come on and do the 3-month orientation for their new grads. Like, that's why they hired you, just so that they could have experienced nurses to train their brand new nurses that they hired. So if you think you're ready to do all that after 1 year of nursing experience, then, you know, you must be really confident. I don't know if I would have been able to do that after 1 year of nursing experience, but after 2 years, I was definitely able to be, I guess, you know, more of a resource than I would have been able to after 1 year. But people do it. They do.
Yeah, do you feel generally that going to different hospitals or different facilities that you pick up how they're doing it differently at places, and then, you know, kind of, I guess, decide what's best to pass along as you go as a traveler?
I've definitely learned like some practices that some hospitals do are more efficient than others. And so you kind of take along those learned practices with you if it's like more efficient for whatever reason, because every hospital does things differently, right? So a little differently. They have this like 90 to 10% rule where nursing, regardless of facility, is 90% the same. And it's only 10% different, whether it's like a little bit different protocol for like a certain medication drip or something like that. However, maybe they do something different with their central lines or whatever it is, like they usually go over that kind of stuff because they've learned once travelers have come through enough, they learn that the travelers don't know that they like this particular thing done. And during your like one day of classroom orientation during your first week, you will get told about whatever it is that they feel the travel nurses might not be the most familiar with, if it's something they specifically do there. But it doesn't take long to adjust and learn what they like specifically to be done, even if it's weird to you because no one else does it that way. It doesn't take long for somebody to point out to you that they like it done some other way. So that's not a problem at all, adjusting to the way people or places want things done. But most of the time, everything's pretty much the same. And sometimes places do kind of give you a little bit of a side eye, like they don't know that anything. Some people that have only worked at one hospital and one unit, they've never worked anywhere else. They think that that one way of doing things is the only way that it's ever done. And so they kind of give you this side eye, like, what are you doing? Like, are you sure you know what you're doing? Like, they think that you don't know what you're doing, even though the way that you're doing it might be the better, more efficient way that they've just never seen. So you kind of have to learn to like not get super defensive or offended. You know, you just, if they are really, really headstrong about having something done a certain way, then fine, just do it their way and chart whatever you need to chart to cover your butt if you don't agree. But I mean, most of the time, almost everything's got a couple of ways you could do it and it'll still get the job done. So most of the time I, just comply to what they want as best as I can. So right now I'm just adding a little shadowing. I don't know if you guys can see, like,
Oh yeah,
with the crayon. I love using crayons after the markers because then you can like basically shadow all of your stuff. And it gives it a little more detail than it had before. Kind of like the bottom of the leaves are like where they pop out from behind the leaf in front of it, or the petal in front of it. So one other question I get a lot is like about, do you feel safe when you travel alone? And because most people fear either being lonely or maybe feeling a little unsafe traveling alone because they've never really done any travel by themselves before or lived alone before or something along those lines.
mm-hmm.
And I think to myself that like it's probably just safe to do whatever you would be doing at home, like not walking around the city by yourself at night. And if anybody asks if you're alone, like you never confirm that you're alone. Even if you are there living alone, like someone at a restaurant or a bar or even a taxi driver, whoever might ask you like, oh, are you new here? New by yourself? Like I always stick with this rule. I think someone like in London told me, there's always someone waiting for you is what you lead on. So like just the other night, like I'm sure he was just trying to strike conversation, but a taxi driver asked me like, oh, you're new to the area, you here by yourself? And I was like, he's picking me up from the airport, so naturally probably he would ask. But still, just to be on the safe side, I'm always just like, oh no, I have a roommate here. They're waiting for me at the house. So that's one way to make you feel a little more comfortable. But also, I think sharing your location with your friends and family that are home also helps you feel more comfortable. And not simply telling them like, oh, I'm going to this, place at this time, but I found that on Snapchat, I don't know if you guys know this, but if you have Snapchat, there is a location sharing option and you can choose who you want to share your location with, and it's a continuous thing at all times. So I have a handful of friends that from home that they know that like at any time, if for some reason you're not hearing from me or seeing me post or something, you can check my location, or at least the location of my cell phone. At any time, they can see where I am. So that makes me feel a little safer too, traveling alone, because there's a handful of people that can see where I am at all times and check up on me.
Yeah, that's definitely a good thing to think about. Another question I know people might be curious about. Do you have any tips for travel nursing just in California getting started? Because I know it's kind of a longer process than other states as far as getting licensed there and starting.
Yeah, I think doing your applications a few months ahead of time would be a great idea, because you never know how long it's going to take, and California does take a few months notoriously. So yeah, I would just like, before you plan on really coming to California, put your application a few months early, because you're going to have to put in like your online nurses application, your California state license. You're going to need to complete the application online just for the license. You're also going to have to do a background check application and submit actual real fingerprints. Your first time applying to California, you have to go to like either a police station or a UPS store or somewhere that can do actual live scan fingerprints on a piece of physical paper. And you have to mail that paper to the state of California. It'll have like an address specifically for it. And, so that takes a while for them to receive that and get that processed. And they don't start processing your license application until they've processed your background check. So some people don't know that, and then they never submit the real fingerprints. Some people will only submit, or I guess it's not, the live scan is the one that is not physical paper. So I don't know what the term is for the actual paper one, but the old-fashioned one with the paper is the one you have to do first. Every renewal after that for California, you can do live scan, but the first set of fingerprints has to be on paper. So that's why your first time applying for your California license takes forever and a day. Yeah. I'm just going to do some leaves here. Now, these might not look the fanciest, you guys, but they're just simple leaves. I'm going to do some big, like, almost like gumdrop looking leaves, like, and it kind of goes in like that, and then kind of looks like a peach, but it's like, those big fan leaves that's really trending, those plants that everyone has right now. I don't know what they're called.
I don't know what they're called either. I know which ones you're talking about, though.
I love the look of those. People are filling their apartments with them nowadays. Oh, another request of a question that I get a lot is, how do you get good recruiter recommendations, or how do you know like I guess, whose recommendation to take. And I think that whoever you're friends with will have recruiter recommendations, and to always go with someone that you personally know's recommendation. Because if you go on some Facebook group, sorry, my cat is like meowing. If you go on some Facebook group and ask these questions, everyone's gonna like yell out these recruiter recommendations for you, who you don't know, and who you don't know if their recommendation's genuine. They might just be trying to get like a referral bonus or something. So I would ask someone that you actually know, because then you know they're going to give you an honest review. Like, obviously your friends are working with those recruiters for a reason, because they have a good relationship with them and they've, you know, been able to work well with them, or whatever the reason. And the same with like when people ask about pay quotes and stuff, like don't listen to the people on the Facebook groups. You have to actually get, you know, your independent, like your friends can give you an idea of what to expect. Your recruiter can give you a better idea once you start talking to recruiters, because it's always different. It's always fluctuating based on the needs of the hospital and the area and stuff. So don't think that it's all set in stone. It fluctuates all the time in travel nursing. But it always works out to be beneficial in my experience in the past 3 years.
Yeah, so with the recruiter relationship, what do you look for like in a recruiter to, you know, feel good about the relationship that you have with them?
Well, what I like about my relationship with my current recruiter is that she remembers who I am, because sometimes that's an issue. She remembers who I am. She knows what specialty I'm looking for, what areas I'm looking to go. She doesn't have an issue following up with me when I need it. She answers my phone calls and emails, because your recruiters being available to you is sometimes an issue with some companies. So just being able to actually reach them is really nice. Also, a recruiter not being super pushy with like assignments. Sometimes I hear people talking to recruiters that are super pushy about, you know, you taking an assignment that they think would be a good fit for you, but you don't know if it's a good fit for you at the time, type thing. So just not being pushy and knowing what you want, giving you time to think about it. Also, one nice thing about my recruiter is that she knows that I'm night shift and she respects my sleeping time. So she will email me instead of call me.
That's really important.
Yeah. So she'll email me, or sometimes she'll text me if it's like something we want like a little bit of a quicker answer, I guess, which is also fine, because then I can see it when I wake up. And I know there was a time in the past where I had another recruiter who, she just would never remember my request for her to please email me instead of call. So I think just having a recruiter that you get along with in those like professional aspects is good. And, you know, you'll just choose a company that's right for you with the assignments that they have available at the time, if they have assignments where you like to go, because I think every company has their own, like, I guess, like a plethora of assignment options, their own like options that they carry. But for the most part, like, sometimes, I don't want to name any company names, but there are companies that will email you options based on the search engine that you put in that you want information on. Like, I want information on the specialty in this area, and you'll get daily emails with options. So I'm only signed up with those companies so that I can just physically see the options every day instead of having to like ask. And I just ask my recruiter, like, hey, do you have this option available? And they always have. She always has it available. She's like, yeah, we can reach out for that. I'm like, okay, great. But at least it gives me like something in my inbox every day that I can see the options available, which I feel like that's probably the way that most companies are moving towards, because I've seen a few companies doing that nowadays. So it just makes it easier for everyone to keep their eyeballs open to what's available.
And it looks like we have another question. Which state have you stayed more than 13 weeks?
Oh, so the only states that I've stayed more than 13 weeks are California and Massachusetts. I love Massachusetts. But like I was saying, those winters are just brutal. So I stayed for 2 assignments there, and then I even went back for a third one like a year later. But right now in the Bay Area of California, I've moved around a little bit with assignments here and just kind of stayed in the area. It's still considered the same area because it's like the hospitals I've been working at are like, they're like less than half an hour from each other. But I just love the area so much, and so I want to stay. I love it here. And someone was asking me the other day if this is my favorite location, if I think I'm going to just keep on renewing contracts in this area, if I want to travel elsewhere. And I don't want to say I'll never travel anywhere else, but I do think at this time, like for the majority of the time, I think I'm going to just keep getting contracts in this general area, because I'll take my 30 days off for the year, you know, so I can maintain my tax home, whatever. But I just love this area so much. Like, this is where I want to keep coming back for work. And plus California, everybody knows California's got a really good nursing union that protects us from like getting extra patients and like stuff like that. It makes sure that we have the resources we need. So it makes your work life a lot easier than other parts of the country, because I've worked in multiple states. I've worked in Florida, South Carolina, Maryland, Massachusetts, and then California. And California is definitely by far the best state that I've worked in, the best work experience that I've worked in. So I just keep coming back. I did work in Southern California for one contract, but I like Northern California more because there's more options for like the nature aspect. They have different types of terrain up here, whereas Southern California is actually really deserty, more deserty than you would think from TV. It's not a tropical paradise like everyone says. It's really not. Florida is a tropical paradise, a true tropical paradise. But Southern California is not. It's very dry, and the deserts can be really cool and really fun. But for me, like when I was done with my Southern California assignment, I was so excited to see green again when I left, because everything was just brown or tan. So I think I was driving, like when I got like to the other side of Texas, driving back to California on like what's over there, like Mississippi and stuff, and I finally saw green again. I didn't realize how much I missed seeing green until I saw it, and I was like, oh no, I can't live in the desert.
I'm with you.
But the red rocks in like Sedona and Arizona and stuff like that, what is it, Yellowstone National Park, all that, they're beautiful and amazing to visit, but I couldn't live there long term. But that's what's good about travel nursing, is that you get to go to these places and experience that, and so you know if you like it or not by the time you leave. So yeah.
And I know we've talked about it too, but as going back to Florida on assignments too, to be, you know, kind of closer to some family, maybe you can mention that as well for people that might be curious about that option too.
Yeah, so, you know, every once in a while you do get homesick. So, especially like, you know, when you've been traveling for a few years. So, last year I got pretty homesick and wanted to be closer to one of my sisters that lives on the opposite side of the state from where I currently live. So, I took an assignment down near her. And it was great, and had 3 months. being closer to her and being able to do things with her on her and I's days off. And I mean, I think most people think that to travel, you have to go like out of state or super far away, like not even drivable distance home, but that's not the case. Like a lot of people that get into travel nursing only do local travel. And it's because some of them like have kids and they can't go too far from their kids. They need to be able to drive home on their days off. And so that's a good option for them, is just doing local travel jobs. So I like that option too. I think it's, what is it, within, has to just be within or out of a 90-mile radius or something like that. Don't quote me, but it's something like that.
Yeah, I was
And then
gonna say, don't quote me either. But
yeah.
yeah, it's definitely, I was gonna say, as far as the terminology is always difficult as far as that goes, like local, but also travel. But yeah, it's definitely something to discuss with your recruiter, and also a tax professional too, as far as figuring that all out. But yeah, people that are doing more of like a drivable distance versus going across the country or taking a flight or something.
For sure. And also, I guess I could mention too, like, when people think of working through an agency as a traveler, you can work through agencies, through travel agencies, and even if you're not outside that radius, you can be considered a local traveler, and so that your pay isn't like taking take home, like not getting stipends, but it still works out financially beneficial for you to work through agencies, because they just offer a little bit of a higher rate than the facilities do, because you're only temporary, you're filling the need, right? So that is what we do in our job. So we fill the need when places are really desperately short-staffed or need extra help for whatever reason. So there's lots of options, is just my point. Tons of options to ask about.
Have you ever put your art on like a greeting card or something like that? I feel like those would lend themselves very well to that sort of thing.
Yeah, because like, so one thing I do with my art a lot is I color while I'm listening to podcasts, and it's like a mindless activity I can do while I listen to something enjoyable, right? And so what I do with them all is I wind up like turning the back into a letter and sending it to either like my little nieces and nephews or my mom or to someone, because one, it's really nice to get something in the mail. We don't get a lot of stuff in the mail that's enjoyable nowadays, like actual letters from loved ones. So I found that that's a really useful thing for my artwork. And people seem to like it, especially the kids in the family. You know, they just like getting something in the mail. It's so exciting to get something in the mail, and so they like it, even if it's not that great. One time I drew a parrot for one of my little nephews, and it looked awful, but he loved it.
Oh, that's funny.
So it's fun for me, and then it also just results in something nice that you can send someone else. So okay. And I might be about done with this one. I might just have this vine come up some. Okay.
And I guess you've talked about your favorite destination probably being California and like the Bay Area where you are now. Are there any other places on your list for maybe future assignments or other travel nurses that have been other places that sound exciting?
I love the idea of Hawaii. I think it's great. The only problem with Hawaii is that I've heard from everyone is that there is kind of a limited availability to make profit while you're there. So when you go to Hawaii, you're really there for the experience. You're really there for enjoying the views, living the local life. And a lot of people break even or even wind up kind of losing money each month while they're there, just a little bit, because housing is not all that abundant there. So when you find housing, it is a little more expensive than you would probably think. And it's a high desirable destination, just like Florida or San Diego, Hawaii. They're all this tropical, nice weather places. So when you go there, you're going there for the experience. So one day I will definitely go, but one thing that hinders me from going that I've heard from other travelers is if you bring your pets have to go through somewhat of a quarantine when you get to Hawaii. Any animals you bring on the island. And they said it can be anywhere from like 2 to 5 days sometimes that you won't get your pet back. And I guess they do something to ensure their health and stuff like that. And so, yeah, I have my cat, and I guess ideally I'd like to go without him so that he doesn't have to be separated from me and potentially scared being checked out for like up to 5 days. But yeah, I don't know. I guess I'm not ready to part ways with him. I've declined assignments because housing has been mandatory and not allowing pets. And I've been traveling with my cat. He's actually right here if you guys want to see him. I've been traveling with him. I mean, my whole life. His whole life I've had him. He's 11 in October. So I've had him all 11 years. So since I had his mother and she birthed him. So here we are. So yeah, this is really the finished product of the drawing. Like sometimes I'll go in with some green for the leaves. How much time do we have left?
Yeah, I was just about to say a little under 5 minutes now.
Okay. So maybe I'll do some green highlights for the leaves, but a lot of times I actually like the black and white feeling of the leaves. But I might just go and do like some highlights on them.
Yeah, I don't see any other questions coming in. So if anyone has any other questions, we have a couple more minutes. But is there anything else, Jessie, I guess, that we haven't covered that you think would be good for people to hear? We talked about a lot.
We have talked about a lot. Let me see. I have a few notes written down here, so let me see. Oh, another good way to socialize when you're out and about on your trips is you can meet a lot of travel nurses on Instagram. People follow hashtags on Instagram, and I follow the hashtag travel nurse and met quite a few people that were in the Bay Area while I've been out here that I met through Instagram. So that's one way to meet people. Also, companies all the time are hosting meetups, travel nurse meetups. And regardless of what company it is, they're always welcoming travelers. So you don't have to really work for them and stuff. That's a good way to meet other travel nurses. Also at work, of course, is another good way to meet travel nurses. But let me see. Spending time, like if you're in a hotel or in an apartment or a condo or something, usually there's like a lobby or a pool area or something like that you can kind of hang out, and like you're bound to find an excuse to talk to people down there eventually. I've met multiple people doing that. One person asked me, is it difficult to date or maintain friendships when you travel? And I think sometimes it can be, especially like if you're not done traveling, like you have a lot more places to see. But I think at this point for me, I see myself mostly traveling back and forth from the San Francisco area and Orlando because I do know people here in both locations. So I have somewhat of a support system and social life in both places. And eventually that makes a difference, but I could easily see myself going for like 3 months, to another location like Denver, Colorado, or Austin, Texas. Those are two places I still would really like to go. So we'll see if those happen maybe this coming year. Yeah, I think those are mostly the main points that I wanted to make, because usually when people reach out to me on Instagram, it's because they have questions about how to even get started or how to prevent getting a case of the lonelies on your assignment. Which, just to point out, everyone will get a case of the lonelies when you're living on yourself by yourself for the first time. It's just a natural growth process that everyone will go through. It's inevitable. When you've never been by yourself, you're gonna go through it, but it's okay. Everyone goes through it. You just gotta get yourself back out there afterwards. And it's like hard to not meet people. You're gonna meet people, You just have to know that there are definitely people out there that are traveling too. And I've met people that are traveling outside of healthcare while on my travels. A lot of people from other countries are traveling. And I mean, I've met people from like Turkey and Lebanon and all kind of places I never would have expected to meet people from. And I love it. So this lifestyle is addicting. So once you get into it, you might not want to leave.
Yeah, it does seem like a really strong community. So it's good to know that there are ways to meet friends, whether they are other travel nurses or not. And also you can do a lot on your own, as we've seen with just like doing a doodle project, which I really feel like I can't call that a doodle. It's way prettier than that. But I'll just plug, as we're wrapping up here on time, that if you do have questions for Jessie, her Instagram handle is Messy Jessie Lee. It's also tagged on a bunch of stuff that we've had recently promoting this event, and we'll have the recording available for people that were not able to join us live, or maybe again want something that's more guided. So we'll have that as well. And if you have your completed work, you can send them to Jessie. Should they send them to you on Instagram? Would that be the best place?
Yeah, probably.
Okay, cool. Well, yeah, I'll have to go back and do this, since I was kind of more so on the technical end this time. But thank you so much for joining us today, both you, Jessie, and everyone who asked questions. We'll follow up with those who did ask questions for your free t-shirt. And if you do have any other questions during the recording, just reach out to myself and I can put you in contact with Jessie, or you can reach out to Jessie directly on Instagram as well. So thanks again, Jessie.
You're welcome. Thanks for having me. This has been so fun.
Okay, thanks guys. We'll end it here. Thanks.
All right.
Bye.